Hello everyone, it's Dr. Joleen Falkenburg, the Niobrara County Hospital Medical Director. This is your weekly COVID update. I don't know if these are absolutely necessary every week because not a lot has changed, but I feel like there's a lot of misinformation or non-information out there in the media, the news, Facebook, which I'm posting onto. So I think it's useful for you guys to hear from me and at least try to dispel some rumors and give you some information. The first thing I realized after our conversation last week was that I didn't explain probably how the case works for contact tracing, is the terminology the Department of Health utilizes. Once the case is identified, the Department of Health contacts the patient, tries to understand close contacts that could be at risk. So if you didn't get a phone call, you are not at risk more than any of the rest of us. There is some information that you have to be around someone's space for a certain amount of time to have high risk of transmission. And the guidelines are usually 10 minutes in an enclosed space. So household contacts, people you work with. If there was a public health risk, like a case was diagnosed and was a restaurant worker, the Department of Health would release that and you'd be aware of it. So I felt like I should explain that a little bit better so people understood how the contact tracing is performed. That also brings up to mind that these patients or cases will return to the normal community. They're given an order from the Department of Health for a quarantine, which I think people have been very compliant with. But as these people return to the community and you have figured out who they are, be kind to them. They followed the quarantine guidelines and they are allowed to return to the community and are no longer contagious. We're obviously in a stage of life we're not hugging right now, so I don't expect you to be especially nice, but I don't want you to be judgmental or critical. These are good people in our community, and it is not their fault that this happened. So please try to be pleasant as people return into the grocery stores and elsewhere and are active once again. This week we had 3 negative tests. One is still pending at the Department of Health. Hopefully we'll come back tomorrow. I actually saw fewer upper respiratory cases this week than last week, but I was very disappointed that my patient I saw on Monday turned back negative. I know that sounds sort of silly, but in medicine, of course, we pride ourselves on our clinical skill set and believing that we know a diagnosis before the test confirms it. And I really felt this patient had COVID. It still makes me believe that the test is not a great test, especially when done at certain time intervals. And that's why I still believe COVID is circulating in our communities. It's why the social distancing guidelines are in place. And we really like you to continue to participate in them, work on your good hand hygiene and such. I would like to tell you I know when all this is going to peak and happen, but I think I had told you guys before I thought we may see a peak by Easter, and we obviously have not. It's slowly coming through, hopefully a peak by May. This family of coronaviruses or the upper respiratory illnesses typically have been viruses that die off with summer. We don't know that yet about this virus, so I wish I could promise you that, but I'm hopeful for getting back to our lives sometime mid-May to June. I know the governor will come out with a statement later to talk about releasing or reopening the state, and we don't really know how that's going to unfold yet. I don't want anyone to riot or rally or be upset. We are certainly going to eventually start to reopen in some fashion, but that has to be done appropriately and slowly so we don't put people at risk and burden our healthcare systems. But I know everyone's getting very frustrated by the isolation, by the financial ramifications of not working, and we will work on it as best we can to reopen as quickly as we can. There are some rapid tests available. You guys may have heard some information about that from Abbott and the company that creates them. It's testing as well as a specific machine. I unfortunately don't have that. It was released, about 5,500 test kits were released to 18 states. Wyoming did get some. I don't know how they decide which counties get them or do not. Park County, for example, I understood got one, but they only got 7 tests, so still not what we're hopeful for. We could certainly make this go through quicker if we had rapid testing, could isolate contacts, and it's just not available to us yet. But that's the goal, and I just wanted you to know it is out there, but I don't have it available. It's no one's fault. It's just the difficult situation that we're all in. I wanted to talk a little bit again about hydroxychloroquine, Plaquenil, which is the medicine that's gotten a lot of press. Once again, the problem in medicine is we really would like to study things in large data sets of large patient sets. Did they have success? Did they have side effects? Did the benefits outweigh the risks? And we're all at such a time frame right here that we don't want to wait for that data. We want to try things. I personally think it's a decent drug to try in the appropriate setting. Right now, they're really trying it in hospitalized patients or critical patients. And in some ways I feel like we're missing the boat on that. Maybe we should try the middle ground. Don't just give it prophylactically or preventatively. Don't give it for mild cases, but maybe as people are deteriorating before they become critical, we consider utilizing it. But I don't want people to think it doesn't bear side effects. I've seen some reports out there that say it's really tolerable. It can cause retinopathy, which leads to blindness, and is contraindicated in patients at risk for retinopathy. And it also has a risk of a certain type of heart arrhythmia that can lead to death. So I want people to understand it does bear risk, and we're still studying it, and I'm aware of those studies, and I'm trying to stay on top of it. I'm going to plan a town hall meeting with my public health nurse, who has been super helpful to me. I really appreciate all the support I've received from public health, Melanie Pierce, Heather Saul, James Santa Stevens, who's our emergency management coordinator, the county commissioners, the city council. But we're going to organize a virtual town hall meeting and accept your questions and try to answer any questions the community has. I'm organizing that, and we'll finalize plans and let you know where you can submit questions or drop them off in the next week, and when the town hall meeting will be. Hoping to just make sure that I'm reaching out and discussing things with the community that you're worried about. Finally, I realized in the past couple weeks that a lot of people are watching this that I don't even know, which I guess is a good thing, but makes me remind myself that I better be on top of my game and be informed. So I thought I should let you know that I was born in Lusk, actually, and grew up on a ranch in rural South Dakota and Nebraska. And I'm sharing that because I don't want you to think that I don't understand the devastation this has for our rural area. I respect what you all need to do, and that you all need to work. You want to get back to your normal way of life, and I'll try as best as I can to get there when we can. But right now we're just at the start of this, not the peak. So please be patient with your governmental officials. Be kind. We're trying as hard as we can to get on top of this and get the state back to where it was before. I also want to remind you that being from the tri-state area, we are all a kind and godly and hopeful people. So be nice to each other. Don't stress people out. We're all working as hard as we can. Clinic is still open, and we are here for you. We are working in cases of patients who waited too long sometimes because they were scared of COVID. If you have chest pain, if you have a problem, you should still contact your doctor or come in and see us. The clinic number is 307-334-4000, extension 223. You will be screened over the phone. You will be triaged to the appropriate place, but we want you to know that we're here for you. And we'll continue the fight, and I really appreciate my staff and all their diligence. I hope you guys are getting along, and if you have any questions, just call. Thank you.